In the world of professional sports, dreams can shatter in an instant. Welcome to eCommunic and get to know the story of Ali Karimi, a professional soccer player who was out of the game due to his hip impingement and made his way back to the Soccer World Cup. Ali presented at our office with a long-lasting hip injury. The diagnosis of Femoroacetabular Impingement Syndrome, or hip impingement, had put him on the sidelines for already 8 months. In spite of intensive conservative therapy, an agonizing hip pain had become his constant companion and really threatened his career as a professional soccer player. Hip impingement is a common cause of hip pain in athletes, where the bones of the hip joint abnormally rub against each other, causing pain, cartilage damage and reduced mobility. Since hip impingement is a mechanical problem, physiotherapy alone can usually not solve the problem. To successfully treat the hip impingement, we had to remove the bony deformity and treat the cartilage damage with surgery, improve the biologic regeneration of the hip joint with stem cell therapy and injections, stabilize and strengthen the hip joint, and finally bring the patient back to play on the field. This can only be done and achieved in a team of specialists working closely together. Experienced hip surgeons can treat the bony deformity causing hip impingement by hip arthroscopy. Hip arthroscopy, often referred to as keyhole surgery, is a minimally invasive procedure. In this procedure, a small camera and specialized instruments are inserted through tiny incisions in the hip joint to visualize and correct any abnormalities, such as bone spurs that cause impingement, damaged cartilage or labral tears. Hip arthroscopy offers several advantages, including shorter recovery times, reduced pain and minimal scarring, making it an effective and preferred option for many patients and especially athletes with hip impingement. In the case of our patient, we removed all bony deformities causing hip impingement and treated the cartilage damage with an artificial cartilage membrane based on hyaluronic acid.
Treatment of the mechanical problem is only one part of the story. Apart from surgery, we wanted to do anything possible to help the injured hip joint to recover. At the moment, stem cell therapy is a cutting-edge technology for joint regeneration and involves the use of the patient's own stem cells. These versatile cells have the unique ability to differentiate into various cell types, including those found in joint tissues. When injected into the damaged joint, stem cells promote tissue repair and regeneration by stimulating the body's natural healing processes. And this can then result in reduced pain, improved joint function and potentially long-lasting relief for individuals with joint damage or degeneration. In Ali's case, we successfully performed stem cell therapy 8 weeks after surgery, which certainly helped him in his rehabilitation process.
After undergoing hip impingement surgery, physiotherapy and rehabilitation play a vital role in the athlete's journey back to the field. The primary goal is to restore mobility, strength and functionality to the hip joint, but also protect the joint from overload injuries. Our physios and athletic coaches work closely with the athlete, monitoring the progress and ensuring that the individually tailored rehabilitation plan is followed. The athlete's commitment and the guidance of skilled physios are instrumental in the successful return to play. Hip impingement surgery may be a hurdle, but it's one that can be overcome with the right support and treatment.
Ali Karimi! Nefis bir gol attı! Ali Karimi 2-0 15. dakika. Ceza sahasına yönelecek topu Gökhan yerden gönderdi içeriye, boş şansı, top alanda gol! Ali Karimi atıyor ama